Dear world, let's get out of here. Let's take a trip to Paris and lose ourselves in the cobbled Parisian streets without a worry of time or a sense of direction in mind. Let's follow the sounds of accordions wrapped around the leafy alleyways and pick pastries along the way. Let's get an appreciation of those fine culinary arts. Let's get an appreciation of the arts. Why don't we take a tour of the Louvre and immerse ourselves into its extensive trove of art monuments and history? Like, for example, Delacroix's Liberty Leading the People, where classically modeled figures are painted in the gritty realism of the French Revolution. Or Caravaggio's Death of a Virgin, where the consensus of biblical representation in art is rejected to paint people in a down-to-earth way. Or what about Ingres's La Grande Obélisque, where formulaically we've created a distance between us and the painting, using her gaze to draw us in. And that concludes the end of the tour of the Louvre. Now I want to ask a question. If we were now to step outside and speak to any person that we might find on the street and ask this French local to ask us about the paintings themselves and to tell them the stories of the paintings, without speaking French, how would we communicate this? Or in other words, without speaking the language of mental health, how do we know when and how to help a friend with depression? Learning the language of mental health requires a set of rules, syntax, and grammar that we have to follow. And learning any language has the culture of such a language shape the nature of its communication. Learning French, or German, or Spanish follows this. And with mental health, the words that we so carefully choose, or carelessly choose, has an impact to impact those on something far greater than just ourselves. The term mental health awareness has become so ubiquitous a phrase, many believe it will soon start to lose its meaning. So with this, what is the next step? It's one thing to be able to help a loved one, but to provide support to a colleague at work or someone across you on the bus requires mental health action. And by learning the steps of mental health language, we can take this action. We can be the link necessary to provide support to those around us that we love and need to support. So what's the first step? While it may sound a little counterintuitive, the first step requires no talking whatsoever. But we will still be communicating. Here, we need to understand that we require empathy and not just sympathy. And the art of active listening can help us with this. This is where we provide feedback in a conversation, showing that in a comprehensive and responsive manner, we're not just listening to someone, but also understanding their feedback and their key parts of what they're telling us. So to do this, consider your posture, your proximity to the person that you're speaking to, the eye contact that you're making. Are we nodding our heads and repeating key parts of the conversation that they feed to us? Research has shown that distress can increase in times of isolation, and when our experiences are so different from one another, and facing a mental health challenge can make us feel so alone. Being an honest listener can provide the space necessary to open up, and it all takes just a bit of listening. People commit crimes. People commit moral atrocities, but people die by suicide. The definition of suicide and its description was based on the fact that originally it carried an illegal status. Today, however, it carries criminal connotations to say that people commit suicide. Because of this, today our use of language has not yet changed, and nor have our perspectives of those today that may suffer these mental health conditions. Many professionals advocate for the use of people-first language, where we see past labels, removing the agency of the effects of a mental health condition, and instead see people as people. We have labels today that we attach that define people who they are today, and instead we should be looking past these as not definitions of who you are today, or who you will be tomorrow. So stigmas can be very sticky. And in these cases, they can prevent us from getting jobs. They can have us treated differently. And sometimes they could even prevent us from recovering. Research has shown that stigmas that carry connotations of their shame and illegality can put us in a position where we will prevent the seeking of helpful behaviors and even sometimes increase the likelihood of them occurring. In these instances, the power of just one word can change this and change the world of someone through the careful selection of language. In the same way, we challenge these stigmas that are perpetuated by society, but we also have to challenge the self-stigmas that come from just within us. As a species, we are meaning makers, pattern seekers, and also storytellers. And our understanding of the world around us is shaped by these qualities. However, within the context of mental health, we don't tell stories. We keep things to ourselves. We cling to self-stigmas. As a result, we don't explain, we don't learn, and therefore, we can't help. This is why we have to claim our own narratives and tell our own stories to challenge these self-stigmas. 10 years ago today, my mum, Jacqueline, passed away from suicide. It was the hardest thing to ever happen to my family and I. And only by telling our stories, by being there for one another, were we able to understand the gravity of the situation. Outside of the family, however, I wouldn't talk about these stories. I would learn to dodge questions, to ignore mum jokes, and also to stay quiet when people spoke about their mums. I was scared. And as a result of being scared, I didn't mention it to anyone at all. Only until I started hearing from people with direct experiences with suicide. All of them having stories that they wanted to tell, but also stories that they needed help understanding. By challenging this self-stigma, by taking it upon yourself to narrate your own story, you can break down these barriers, and as a result, see growth. The next step is to notice if someone is at risk. As a species, we are meaning makers and pattern finders. And you're probably picking up on the fact that I've now said this twice. That's because we're really great at spotting anomalies and inconsistencies. That's because we're really great at spotting anomalies and... You see, the human brain receives so much information that we need to use a process of separating the signal from the noise. And this filtering mechanism is simply called attention. Some of it is automatic, but some of it is also controlled. So have a think, where do you control your attention? In the morning, is it to the papers? Is it to your breakfast cereal? Or is it to the person that sits across to you in the table? There's a technique that we can use to overcome this, and it's called effective perspective taking. And this is where we use our attention by trying to empathize with others, considering the inference of their emotions. By doing so, not only can we better understand the context of someone's behaviors and why they might occur, but it also improves interpersonal relationships with others. So think about it. Friends that you don't see as often, what might be happening with them? People at work who seem always tired, what might they be going through? Even people who don't start as many conversations as they once used to. Why might not they want to? These are questions that we have to consider when we look at such symptoms of mental health behaviors. Because even though symptoms can be different across different conditions, there is a lot of information out there that we can use, such as self-help articles and online courses, to have a look out for some of these signs. And even though it's important to focus on these, spotting the anomalies and inconsistencies doesn't require a medical license or a psychology degree. Once we do this, the next step is knowing how we can make a connection and asking a vital question. Recent research has shown that the best way to try and begin to help someone with this is to collaborate with them in a co-constructed manner that can help have some beginnings within a conversation where we show what they're there to help and not just to listening, taking active listening one step further. In these situations, we have to ask questions such as, what has happened to you, that look further and invite a conversation where a multitude of factors can start a discussion, rather than looking at just one defining feature and problem which may be centered and critical. In such cases, we have to look past this and consider the individual and everything around them, and not just one mental condition which they may be suffering from. Next, we need to understand how to keep support close to us. We live in a digital age, in an interconnected society where information superhighways can transmit self-help articles, research reports, and also online phone books of all mental health care practices close to us. And to be able to change the world, all we need is a keyboard and an internet connection to get all of this. It's an empowering thought to consider that with only these tools, all of us can do it. Or even easier, with a more common denominator, such as a mobile phone that all of us have in our pockets. However, while all of us may have one, we don't all use it in the same way. The language of mental health that we use has to be carefully considered for other people, but also for machines. Search engines are very sensitive to the information that we feed them, with keywords changing the results that we get to see. So what are we searching for? Are we considering the symptoms of certain mental health challenges? Is our language emotional, or is it more clinical? Are we looking for articles which have clickbait in the titles, or are we looking for something which is referenced by medical guidelines? In this interconnected world, we can find this and support other people, but we can also dive a little deeper. Self-care strategies are preventative, and professional support can help be protective. And these are two different sources of help which we need to provide people at different stages of when a mental condition might be faced. And this is because mental health flows like a river. In the upstream, the waters run much more slowly, and it's much shallower when we're there. As a result, it's easier to swim to the shore. However, the further downstream that we head, the more turbulent the waters become, and the harder it is to take ourselves out from this river. At different stages in our lives, all of us will be at different points down within this river, and it depends on how we know which access of support to provide to be able to get out of there. We're all equally susceptible to these mental health challenges, and by understanding when we need preventative care and when we need professional protective care, we can know how is best to be able to take ourselves out of this part in the river. So looking towards the future, how can we build a world where we democratize mental health support? And how can we make it so that we're all bilingual in the language of mental health? This year, I've been working on a project with a few other students called I Speak Mental Health, where we're building evidence-based mental health first aid kits to support those in need that may find themselves floating past the upstream of the river. In these cases, it's really important to consider the psychology of design, but our goal is to focus on the design of psychology, how we can build resources that are capable of challenging these stigmas, using a more appropriate vocabulary, and also building confidence to provide support to those in need. And all of these can come together so that we ourselves can be the necessary link to provide support to other people when speaking the language of mental health. In a world so large, but also so interconnected, sometimes it can seem difficult as just one individual trying to make a change like this. But I want to share with you the results of a fascinating study conducted by psychologists in the 1960s. They sent out letters to people all across the corners of America, asking them to forward the letter to a Mr. Jacobs in Boston. Now, these people were from all over the States, and despite living in a country with hundreds of millions of people and sending out hundreds of letters, they made a fascinating discovery. And that is that it took only an average number of 6 correspondences to get the letter to Mr. Jacobs in Boston, regardless of who you were. 6 degrees of separation. Here in university, we live in the midst of a social explosion, where we're capable of seeing people all around us in much more frequent time periods. For example, have a look around the audience today. How many people do you know, or even just recognize? Because of this, we're capable of sharing things such as freshers' flus, or trends, or even ideas, here in Glasgow in the West End, which I consider to be a 2-degree of separation city. So like this, as individuals, we can be that link necessary to set off the chain reaction to a greater network of people within our small 2-degree of separation cities that is capable of providing support where they need it. And in order to achieve this, in order to provide mental health action when speaking the language of mental health, I think we need some much bigger picture thinking so that we can turn this dear world into dear you. Thank you.